Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving into a complex and sometimes challenging condition affecting both our human and animal companions, osteonecrosis of the jaw, or ONJ.
This condition is considered rare in dogs. The study aimed to evaluate whether similar risk factors and comorbidities seen in human ONJ might be present in dogs diagnosed with what they termed idiopathic ONJ. Their definition of idiopathic ONJ in this study was based on the presence of visible necrotic bone in the oral cavity in dogs without a history of common known causes like electric burns, radiation therapy, maxillofacial trauma, embedded oral foreign bodies, prolonged corticosteroid usage, or the administration of drugs known to cause mirage. The study was a retrospective review of medical records from 10 dogs diagnosed with this condition. The methodology involved reviewing patient signalment, diagnostic results, and treatment information. Advanced imaging, such as cone beam or conventional computed tomography, was frequently performed, which allowed for detailed evaluation of the maxillofacial structures affected. By excluding cases with known causes of ONJ in humans or animals, they sought to isolate a group where the underlying etiology was unclear, hence idiopathic.
In this specific cohort of 10 dogs diagnosed with idiopathic ONJ, the findings presented in the results section offer some interesting insights and comparisons to human ONJ. The median age of the dogs was 6.5 years, with a range from 4 to 12 years. There were 3 neutered males and 7 spayed females. 7 distinct breeds were represented. When looking at comorbidities commonly associated with human ONJ, this small canine cohort did not show an overt association with factors like advanced age, female gender, hypertension, anemia, diabetes mellitus, hyperlipidemia, or hypothyroidism. The authors cautioned that this lack of association could be due to the small sample size. Specific comorbidities noted in some dogs included atopy, recurrent urinary tract infections, and hypothyroidism. None of the dogs were receiving steroids at the time they developed clinical signs, although one had received oral steroids transiently years prior, and some received steroids for the clinical signs of ONJ itself. Owner-reported clinical signs were varied but often involved local signs like facial swelling in 6 of 10 dogs, halitosis, 5 of 10, and oral pain, 3 of 10, as well as more systemic signs such as lethargy, 5 of 10, and inappetence or difficulty eating, 3 of 10. Other reported signs included ipsilateral epiphora, weight loss, tylism, nasal discharge, blepharospasm, epistaxis, and even an exfoliated tooth. The median duration of these clinical signs before a veterinarian suspected ONJ was 12 weeks.
Thank you for listening to the Veterinary Medicine Digest. Keep those minds inspired, hearts light, and tails wagging. If you're enjoying this, remember to like, share, and subscribe as proceeds from this channel go directly to providing vital veterinary care for animals in need.